I'm Dr. Pavitra, and I'm going to talk about pain management strategies during labor. So how do you cope with pain during labor? We have heard so many times people saying that, oh, it's so difficult, labor is very painful. But what are we doing about it? Are we doing something to combat the pain? Are we just giving into the sensation that it's going to be painful? Or are we going to crib about it the whole time that it's going to be painful and it's going to be painful and then just do nothing about it? Are there any natural alternatives for pain relief? Yes, definitely there are natural alternatives for pain relief. Even before you take a medicine or any epidural, there are many ways with which you can cope the pain in labor. One of those are the birth ball. It is ideally advised to start using the birth ball right from your pregnancy. Birth ball makes you sit very comfortably, and it gives you enough movement which is required when you are sitting on the birth ball. Rocking slowly on a birth ball, front and back movements and swaying would greatly help the descent of the baby. A lot of people during birth lie down on a bed on a back position, which actually enhances the pain sensation. If you want to cope better with pain, the best thing to do is walk, move and change positions during labor. And birth ball is a great tool for movement and to change positions. The second thing is water. Water is a beautiful tool. It soothes the muscles, and a gentle flow of water on the back and the areas which is aching would relieve the pressure to a lot of extent. Also, massage in water is a wonderful tool to combat even the highest levels of pain. When I'm talking about massage, counter pressure is a great tool, especially for mothers having back labor and long labor. Counter pressure in the back region and all on four positions would greatly reduce the pain because the load is taken off from the back and it's more in a forward position where there would be more space created for the baby to rotate, and the labor also will progress really fast. Other than this, deep breathing, relaxation would, with deep breathing, with every breath you take, the pressure which is built up in the mother can be released completely. Deep breathing followed by short and long breaths, alternate between deep breathing and short breathing to mid-level breathing, would let out any tension which is building up inside the mother. Another very good way of combating the contractions is to embrace them. Contractions don't come all of a sudden. There's a pattern in which the contractions come. First they start in a very slow fashion, and then they peak, and then they again come down just like a wave. So if a mother can embrace the contraction, like own the contraction, or to ride the peak of contraction rather than cribbing about it and complaining about it, it would let go of the tension to a large extent. Also, keeping the mother well hydrated. It is very, very important to have continuous fluids and keep the mother well hydrated. When the mother is well hydrated, what happens is there is no concentration of any pain causing elements anywhere. So it would help to a large extent in circulation also. Last but not least, heat. Like we have these rice grains or massages which are rice filled, or water bags with hot water filled in them are a great tool to relieving backache. So applying pressure along with this heat compresses would help in combating the pain of labor.